results for the latent growth modeling for hypothesis 1, which was, could we replicate that having 1 or 2 copies of the risk allele would be associated with risk behavior initiation or past 30-day involvement in risk behaviors. Did we find that? Again, we did find that, and we replicated the first study. Assignment to SAFE also was associated with less risk behavior initiation and less engagement in risk behaviors during the past 30 days. To test the G by E hypothesis, we formed 4 groups, as you would expect. We did all kinds of tests to see whether these groups differed in any way whatsoever. All the equivalence tests showed no differences. Here's the test of the moderational hypothesis, which shows pretty clearly that youth at genetic risk assigned to the prevention or to the control condition showed a much greater increase in risk behavior initiation across 29 months. And then we also wanted to see if we'd find similar results when we looked at past 30-day involvement in these risk behaviors. So in summary, we did replicate the first study with a different research design. Again, we find that 1 or 2 copies of the short allele with 5-HTT-LPR forecast increases this time in risk behavior initiation and involvement in risk behaviors. Again, we find that exposure to a protective environmental effect was able to ameliorate or condition that risk. And here's some things we're going to do in the future and are doing. Since gene by environment interactions might be time dependent, we're going to look at different developmental stages. We're looking at different genes and different protective factors, and we're also studying epigenetic effects. And here's a picture of some of the people at the Center for Family Research. And this is probably the most important slide, because these are all the people who do all the hard work to make these results possible. So thank you very much.
We have a couple moments for questions for Dr. Brody before we roll into the second part of this lecture. People have any burning questions right now? Okay. Please